Joining us now, Tamil Nadu's Health Secretary, Dr. J. Radhakrishnan. Doctor, thank you very much for your time. Tamil Nadu has made home quarantine mandatory now for all the international passengers, even if they come from not at-risk countries. What made this?
No. See, the challenge which we were facing is that, though comparatively our international travelers coming to Chennai compared to cities like Mumbai, Delhi and all are less, we found that on out of 25 countries where we had positive, almost 13 happened to be non-risk countries. And the first case of confirmed Omicron happened to be a traveler from Nigeria who came via Oman, and he went back after giving his test, and by the time we could trace him back, he had already spread it to 6 of his family members. Second, his co-traveler also got it, and he, by the time we tracked, had given to 4 of his family members, and he had also visited a number of places. Good thing is that when we did the extended contact tracing, it has not spread much. So there's no point in now viewing it as at-risk or non-risk countries and allowing self-health monitoring for the non-risk countries. I'm sure Government of India also is looking at it. So in anticipation of this, what we felt was let them do. Second thing what we noted was, even from at-risk countries, suppose 68 people became positive on the day 1 of test and the arrival. We had 76 others turning positive in the intervening period, especially the 8th day. So this shows that it has to be linked to the incubation period, and we cannot take any chances. So that was the reason.
And this 2% to 5%, 10% rise in random sampling also will help in this.
See, ideally, between you and me, a lot of people think they are RT-PCR negative. Why should we do that entry point test? It should be symptomatic. But we have ourselves seen that at-risk countries, 100% when we tested, out of some 19,000 odd passengers, we found almost 156 people, 68 on day 1 and day. So instead of doing 2%, this person happened to be within the 2%, the first Omicron case. Imagine how many others would be found later. So it is slightly slipping into the community, and an example of that is that 3 of the passenger Omicron, that is SG drop cases, are not linked to any travel. Right. Most importantly and worrisome for us was that in GH, when a diabetic patient for his foot ulcer was being operated, his test result turned out to be S gene drop. It is yet to be confirmed through whole genomic sequencing. But when we took around 3,000 odd contacts, 23 of the healthcare workers, including students, 7 CRRI students, 7 nursing students, 3 nurses and workers and all became positive, out of which 42 were S gene drop. So that shows that we need the same containment measures in a follow-up of the containment very high order. That having said that, we are telling public that this is not a time to worry how many Omicron, how many Delta, but whether we are taking this, masking, social distancing and the COVID appropriate behavior properly, while we are catching up with national average in vaccination rapidly, we are yet slightly 2% behind on both. So we are telling that also, that even now certain youngsters and certain elderly population have not taken the first dose. We are bridging the gap, but still a gap is there.
55% only have taken both doses.
Both doses. So you see, more than comparing with national average, we need to understand that COVID has not gone. So all this increasing pace of vaccination and follow-up of this behavior is mandatory, especially the crowds are the area where this is spreading. And why another worry which we are having with Omicron is, one, all the patients so far have been mild or no symptoms. So many times he may not even know that he has Omicron. In fact, people question us that why you are terming us as positive. But by the time they will spread. So having a mask is always such a safe thing in public places where more than 20 or 20 people crowd.
Any specific Omicron symptoms public should watch out for and report or get themselves tested, sir?
See, so far, here we have not reduced the RT-PCR testing of 1 lakh. We have increased the testing in Chennai because Chennai slightly the cases have started increasing. It is not just linked to test. So if we say that just because we doubled the test 10 to 20,000, we are getting double the number. That means it's a good thing that we are catching them early. That is first point. Second point is that scratchy throat and generally tiredness is the only symptom. In fact, I myself had an opportunity with PP to visit the 13-14 odd patients who were Omicron confirmed. All of them appear to be very, very normal, and they are actually saying that why they were tested. Even on a few of them, they had only grade 1 changes with regard to thing. All are in room air so far. But again, this has to be taken with a pinch of salt, because last time also when actual COVID started, it all started like this. Even I remember the then commissioner telling only 98% is asymptomatic, but slowly it changed. So we cannot let down the guard. That's the thing. And the surprising thing is some of the people who are vaccinated early, their antibody levels have drastically dropped down. That also we do the test. So I think this booster thing, and for children, it's a very, very welcome step which Honorable PM has announced, and our CM has said, Honorable CM has said to follow it very strictly.
Is there an increase in hospitalization now?
See, the numbers have not so far changed, except the cluster hospitalization has increased. That's also out of caution. Wherever SG drop is there, we are telling them to be in hospital, because so that they don't spread. Not necessary that these mild cases everybody has to be in hospital. For that, home quarantine, they should have a separate toilet and maintain that. But on SG drop cases, till WGS result comes, whole genomic sequence. And second is till they actually turn negative, we do the test, unlike the earlier cases that 10 days of hospitalization, 3 days of no fever, release automatic. That we are not doing. So we are also time to time, Government of India is keeping on guiding us, the experts. So that we are strictly following and noting. Adequate medicines are there, adequate beds are there. But since they indicate that there is a likelihood of a vertical increase of cases in case Omicron spreads, we cannot take our chances. We have to be
Approximate numbers in terms of rise in hospitalization?
No, so far only 5 to 6% of the overall 1.15 lakh beds are occupied. And only change we find is, instead of 20 to 30 cases coming to King's Hospital, it's a government hospital, 60 to 70 cases are coming. Second is, people are also now cautious. Routine scratchy throat and lack of fever but tiredness, they get tested. Tamil Nadu has a capacity to test 3.2 lakh RT-PCR cases. So it's all, we need public support at this stage and not public panic.
Lastly, New Year's coming up, any restrictions, curbs?
So far we have given it as an appeal that people should avoid. Already the bigger open places we have, where lakhs of people gather, like beaches, we have said no. But with regard to the hotels and other places, we have said that strictly it should be conforming to the number. And we have also given an appeal that it can be avoided. But these will be reviewed appropriately at various levels. There's a high-level committee at the level of Honorable CM. You would have seen yesterday, Honorable CM personally visited COVID wards and all the facilities himself to make sure that all the WHO and the Government of India guidelines are in place.
And lastly, during the second wave, Tamil Nadu witnessed a shortage of oxygen beds, ICUs. How prepared is the state now, sir?
See, last time we had capacity to store oxygen, but production was around 440 metric tons, or suddenly it became 600. So we had to use the eastern corridor through the national plan. We survived through that. We have storage capacity. Now subsequent to that, we have almost 217 oxygen generator, including 70 kept through PM CARES, which was also visited by Honorable CM yesterday. Then we have 217 oxygen generator, which themselves can supplement around 200 odd metric tons. Plus we have 17,000 oxygen concentrator that also can give another 140 KLR metric ton. That is the unit. I'm slightly getting confused. But ultimately around 400 KL can be generated. That's a backup. But still, in oxygen and storage capacity of the regular liquid oxygen, we have raised it to 1700 tons. But still, in all these health matters, one can never be overconfident. He has to be cautious, and we have to keep on dynamically looking at the trends and looking at the earliest possible signs of any cluster.
Thank you so much, Doctor, for your time. That was Dr. J. Radhakrishnan, Tamil Nadu's Health Secretary, talking to us in Chennai with Suresh, Sam Daniel, Find TV.